Everybody, or now good afternoon. I'm Mike Skelton from the Greater Manchester Chamber and want to welcome you to today's workshop, our virtual workshop on creating healthy communities for healthy businesses. We are excited to bring this forum to you today for a few reasons. First, it is Mental Health Awareness Month, so we thought this conversation was well-timed. And also our panel, as we were just discussing before letting everyone in, we're coming out of a very challenging year from a public health standpoint, but personally, professionally, lots of changes. And so thinking about the health, both in terms of disease, but also in terms of mental health for our workforce and our communities is really important. And so we thought this conversation would be a great way to have that discussion and connect you with some experts and have a good dialogue this morning. Before I get going, just a few housekeeping items. Again, remind everybody if you're not speaking, if you could keep your line on mute. Would definitely welcome people to participate with their cameras on as we go forward, particularly once we get into the Q&A session. I'm going to have each panelist give a brief introduction of themselves with kind of an opening question, and then we'll go right into Q&A. We have some prepared questions that we want to ask our panel, but very much want you to help drive the discussion. So if you have questions, feel free to flag us down. You can also please use the chat, and we'll make sure to recognize you and have a great discussion today. So we have three panelists joining us today. I'm going to introduce each of them, just name and title briefly, but then turn it over to each of them to give a more formal introduction and kind of kick off the discussion with some opening remarks. So our three panelists today are Rick Cornell, who's the Vice President of Community Relations of the Manchester Mental Health Center. Thanks for being here today, Rick. John Broderick, who's the Senior Director of External Affairs at Dartmouth-Hitchcock Health. Thank you for being here, John. And Will Torrey, who's the Interim Department Chair of Psychiatry, also at Dartmouth-Hitchcock. So really great collection of experts and perspectives to hear from today. And we're going to start by asking each of our panelists to just share a little bit more about who they are, what they do, and kind of an opening perspective or question around why they believe mental health awareness is important. So Rick, I'm going to ask you to kick it off. Thanks, Rick.
Well, thank you. And thank everyone for being here today. You know, my name is Rick Cornell, and as you said, I'm the Vice President of Community Relations for the Mental Health Center. I'm approaching my 48th year with this organization, so I've seen a lot of things happen in the community. I've seen a lot of changes happen in the community. Most of my work has been doing clinical work through the years, and of late, doing a little bit of public relations. So it's good for me to get out and to find out what's going on in the community from a different perspective than just sitting in an office talking to people all day long. And so I've gotten to see a lot more about the dynamics of what goes on in this community. And I have to throw in a shout here for the chamber, because this chamber has done so much for this community, and I really want to thank them from our agency in terms of the work that they do, because it's so vitally important. But let's get back to why we're here today. We are here today because we seem to be in this new place, a new place for everyone. The possibilities of what we do with it are endless. We can prosper, we can fail, but I'm pretty sure that most of the people on the Zoom today want to prosper. At least I hope you do. But I think there's more to saying that we just want to prosper. That's a great start, but it doesn't get the change done, the changes that we need to address. And to act like you are different than anybody else doesn't seem to work anymore, does it? I'm sure that there are some people that are more resilient, that just because of their personal environment or their chemistry. But when COVID hit the world, who or what you were didn't really matter anymore, did it? And prior to the hit, we were talking about 1 in 5 Americans having some form of mental illness. But now, when we think of all the anxiety, the depression, grief and loss, families destroyed, businesses, careers gone, what people went through and what they're still going through, I would wonder where that number is now. Common sense tells me it's much higher. And that's why I think there's never been a more important time to be talking about mental health and mental well-being, not only in our community, but more specifically in our businesses. Because if we're going to build ourselves out of this, we've got to start dealing with these problems, because they're going to affect our businesses. They always have, but they're really going to affect our businesses now. So I'll stop there for now. I have a lot more to say, but I'll leave it at that.
Excellent. Thank you, Rick. All right, John, I'm going to turn it over to you. Same question, a little more about you and your background and what you do over at DH, and then share why you think mental health awareness is important.
Well, my background has almost nothing to do with why I'm here. But the reason I'm here is because I've been doing the most important work of my life for the last 5 years, thanks to Dartmouth-Hitchcock. Just so you understand, I've been interviewing your future workforce for the last 5 years. I'm finding them in middle schools and high schools and prep schools and colleges. And it has been eye-opening to me. This generation, by the way, is incredible. I love these kids. They're really smart and really worldly in a lot of ways that I wasn't. They're also dealing with anxiety and depression at epidemic levels. Let me give you this visual. I spoke at a prep school whose name you would instantly know. It's one of the best prep schools in America. And this goes back 2 or 3 years ago, before the pandemic. And after I spoke to these hundreds and hundreds of kids in their auditorium, the senior who introduced me asked his classmates this question. These are the future leaders of the United States. If anyone in this auditorium today, he said, has a mental health problem, or someone you love has a mental health problem, those are the only 2 categories. Would you please stand up? And I thought, no one's going to be standing here. After about 30 seconds, all but 25 kids were standing. All but 25 kids were standing. It was stunning. And it's repeated over and over and over. Last thing I want to say, youth risk behavioral surveys, they're surveys given by the CDC every 2 years to high school kids. 70 high schools in New Hampshire let those students take them. They're anonymous. How old are you? What's your sex? What grade in school are you? The national results from 2019, before the pandemic, are basically as follows. Over 40% of girls in high school are depressed. Think about that. 25% have given serious consideration to killing themselves in the previous 12 months. 15% have actually made plans to kill themselves. About 20% are engaged in non-lethal self-harm, and about 8% have attempted suicide. Those are the kids I see. Those are the kids I hug. Those are the kids looking for jobs. And my message to businesses is it's a bottom line issue for you. These kids are going to look for businesses that are attentive and responsive to their mental health needs and create a culture of safety and understanding. And businesses are a key in doing that. And if you accept that, which I hope you will, change is needed, and it's needed soon, because they're coming to your door. And they're in your business now, by the way. They're just afraid to talk about it, many of them. That's the truth.
Great, thanks, John. Looking forward to exploring more of that as we get into our Q&A. Will, if I can hand it over to you and share a little bit more about yourself and why you think mental health awareness is important.
Thanks. Thank you for having me and for having this event. So I think this topic is, as others have said, extremely important to and relevant to you as business leaders. Psychiatric illnesses are really extremely common, and they're also very treatable. 1 in 5 Americans has a psychiatric illness in any given year, and over our lifetime, about half of us will have a psychiatric illness. So these illnesses aren't just things that happen to other people. If we haven't had one of these illnesses ourselves, we certainly, like John's high school students will have someone we love who's had one of these illnesses, or we're highly likely. And people don't sign up to have a mental illness or an addiction difficulty. No one wants to have alcohol use disorder or depression. These are painful, confusing kinds of conditions to have. And as I said, businesses have a stake in addressing psychiatric illnesses as well. Many employees have these common illnesses. In studies that have looked at this issue in business, there's been a strong business case for being sure people have really good access to care. The depression and back pain are the most expensive illnesses for businesses. About 25% of that cost is in direct care costs, but most of the cost is from absenteeism or impaired ability to work on the job, which is sometimes referred to as presenteeism. You turn up, but you can't really do the job because you're struggling. Studies that have looked into it also show that it's only a minority of people who really get adequate care for depression. And it's even lower for alcohol use disorder. And so the loss in productivity costs, the loss from productivity costs far exceeds the cost of getting treatment. So I actually have been here in New Hampshire since coming as a resident in 1985. So I've been practicing psychiatry here. I'm currently working as the chair of psychiatry for Dartmouth-Hitchcock and for Dartmouth Geisel School of Medicine. You know, I think that over the time I've been here in the state, we've learned more and more about how to help people. And in some ways, we've had less and less of an opportunity to offer that care. It's access in a timely manner to science-supported care is extremely difficult. And I think it's a problem that's not going to be solved by government alone or by any single healthcare organization. I actually think it's going to require a real shift in how we think about these difficulties and a concerted, organized effort coming from business, coming from citizens generally, coming from healthcare professionals, coming from government to really change how we think about mental health and addiction, and to work together to come up with a solution, because it's the current situation is really untenable in my view.
Thanks, Will. I think that's a good jumping off point for our discussion and Q&A. And I think a good general question that would be helpful for everyone, and I know would be helpful for me, is, you know, no matter what particular issue is being talked about by policymakers, and, you know, oftentimes one of the solutions that's brought up is that, well, we need to fix the mental health system in our country. And I'm wondering if we could drill into that for folks who, so they can get a better understanding of that, is, you know, from each of your perspectives, what do you think are the current flaws or challenges with the mental health system that are preventing us from making better progress in this area? So Rick, why don't I start with you and give your thoughts on that?
One of the things that we have dealt with in the field of mental health for years has been the stigma of mental illness. And when you hear people say we've got to fix the mental health system, I think there's some validity to that. But I also think that it comes from a deeper sense that people just have a misunderstanding of mental health. That there is a lot of work to be done in terms of the way mental health systems are funded, the way that mental health systems are able to build themselves in networking with their communities. But more than that is this sort of sense that we've got to get over this them versus us. I think when we look back at what's happened over this past year, if people have learned nothing else, I hope they've learned that them versus us doesn't work anymore. And when COVID hit us, it didn't look at who you were, what your capabilities were, what your skills were. You were just like everybody else. And people with mental illness suffer that ongoing problem of not being able to talk about it. You know, a lot of people don't understand that when they think of mental illness, they think of, you know, the historical, you know, like New Hampshire hospital, people having to be put away, not being able to be free to walk amongst everyone else in the community, and so much negative publicity that mental health has gotten for so many years. But people don't realize that, you know, a few minutes ago when we were talking about 1 in 5 Americans, I have to tell you, I don't believe that that's true. I really believe it's a lot more than 1 in 5 Americans. One of the most common illnesses that we treat is anxiety and depression. How many people in listening to this Zoom today don't know of somebody or have not had a problem with anxiety or depression? And when you look at the uncertainty of what's gone on over this past year with COVID, one can only wonder how many people have dealt with anxiety and depression. Now, did it get to a point where it was a clinical problem that needed treatment? Maybe not. But the reality is we're all susceptible to this. We're all susceptible to mental illness. And so to me, the biggest problem with mental health treatment today is an acceptance of mental health treatment. The fact that it is just as common as anything else, that it should be treated as any other medical problem. And until we start doing that, there'll always be these prejudices about how we fund it, how we manage it, and what we do with it in the community. And one more thing before I let go of this, and that is what Judge Broderick had said about the issue of the workforce. We have a serious problem with workforce right now. And it's not just mental health, it's all the medical profession. You know, over the past 10, 15 years, a lot of youngsters have gone into the tech world, and that's great for business in the tech world, but it's not great for medical. And we need to start helping people understand that these are great careers. And so if we don't make these careers a career that someone can afford to live on, and a career that has some respect to it in a way that it should have, and I think we're working on that, we're not going to draw those people, future generations, to this field. And so I worry about those things all the time. So those are some of the things that I think are the problem.
Thanks, Rick. John, how would you like to build on that answer in terms of, you know, what do you think when discussions around fixing or improving the mental health system in the country are raised?
Yeah, it's a huge task. When we deinstitutionalized people in the 60s and 70s, we used to have 2,400 people on that campus on Pleasant Street. Thank God we don't have that number now. But the deal we made as a nation was we will fund community mental health. And there's a lot of fact-based, evidence-based information that that's where it should be treated, closer to home and in the community. We're not doing that anywhere in America, really. New Hampshire in the late 80s was #1 in the country in community mental health. We're a long way from #1 now. Let me just give you a couple of numbers, which I think tell you what the problem is. We have 333 million Americans. We have 1,400,000 lawyers in America. Do you think that's enough? We have 1.4 million lawyers. We have 675,000 CPAs, and we have 28,000 psychiatrists. And that's not just happening. That's happening because we don't incentivize people, as Rick was saying, to go into mental health. We don't have enough psychiatrists. We don't have enough psychiatric nurse practitioners. We don't have enough mental health counselors because we don't pay for that. Psychiatry is one of the lowest paid professions in the medical field. Everyone thinks they live on Park Avenue. It's hard to see someone. I have hugged more parents who have said to me, John, I can't get my son or daughter in to see anyone for 3 or 4 or 5 months. If you had a teenager who fell today and broke their leg, you'd call 911, they'd send an ambulance to your driveway. If you have a child with chronic mental illness, who do you call? When do you get in? The reason we are not dealing with it is in part for what Rick said. We've never treated it, legitimately treated it as a health issue. Now, I grew up, I'm a baby boomer, not that you could have guessed that. And I remember the stigma. I remember as a child, no adult other than Hugh Hefner ever said the word breast publicly. And people whispered the word cancer. My mother used to whisper. I thought maybe if we say it out loud, we'll contract it. And now we say breast cancer. The Red Sox wear pink cleats, they swing pink bats. Everyone knows the color for breast cancer, every single American. If I said to the folks on this call, what's the color for mental health? I bet a lot of you would say it has a color. I didn't know that. That's why we're not where we need to be. And the last thing I'll say, which should concern all of us, on Valentine's Day this year in our state, 51 adolescents and children were in lockdown, essentially in community hospital emergency rooms, experiencing acute mental health problems. And we don't have enough beds. We don't have enough places to send them. And somehow we tolerate that. Sometimes they're there for hours, sometimes they're there for days. It's immoral the way we treat it. And if you were hugging the kids I'm hugging and hearing the stories, you would know this wasn't working. But as Dr. Torrey said, and what I now know from people like Dr. Torrey and my own family's experience, treatment works. Treatment is possible. Mental illness is not a defect or a deficiency or a character flaw. It's a health problem. And most people, by the way, I'll close with this. Most people with a mental health problem are raising a family, going to school, going to work, maybe even leading a company. But we never see that part because they don't want us to see it. If we could all mature on it, we would solve this problem. And when people are willing to say publicly, my mother, my father, my sister, my cousin, myself, and I can't get care, we'll fix it. Until that day, it'll stay in the shadows where it's rested comfortably. And I'm just impatient for change, and businesses can lead that change. I know you can, and you should be interested in doing it because it'll affect your bottom line at the end of the year in a positive way.
Thanks, John. Will, before we move on to another topic, I'd like to turn to you on this question about your perspective on the mental health system and what needs to be fixed or changed or flaws, or just how you observe that discussion. And as a doctor, as a practitioner in the field, I'm imagining you must have a pretty up close and personal perspective on it, and have some additional thoughts to share to what Rick and John have shared.
Yes, this is what I do every day, and I spent a lot of this morning trying to get people into care who are having difficulty getting into care because there's inadequate care available. I think that, John speaks extremely clearly about this. I don't think it's been resting comfortably in the shadows. I think it's been resting highly uncomfortably in the shadows. People are living with a great deal of pain as they try to get care. Even when they're prepared to get care, it's extremely hard to get it. So, there's no health without mental health. It's not a separate issue. When you have a system, a real system for any healthcare condition, it's a system. It's prepared for the common things that come in the door, the expected things that come in the door. Depression, anxiety, panic disorder, psychosis is not unexpected. These things happen every day. 1 in 100 people has a psychotic illness. 1 in 100 people has bipolar illness. 1 in 100 people has schizophrenia. These are common difficulties. And what you want is a system that knows that it's coming and is ready. And what does it take to move there? I think, to be a prepared system, you need some adequate funding. You need people to take the difficulty seriously. And you need to be prepared. When my wife found that she had breast cancer on a mammogram, the system was ready for her. She had an appointment very quickly. She had a care navigator who helped her get through the system. She was introduced to the oncologist quickly. She met with the surgeon. She understood what was going to happen. The website was clear. The information she was given was clear. She got a gift package when she turned up. That's a prepared system. They're prepared for breast cancer. They know breast cancer is coming in the door. They screen for it. They have the treatment all lined up. They know that you're going to be anxious when you get the diagnosis. They get you into care quickly. And then you get the care as expected because it's there and it's scheduled and it's happening. That is not true in mental health. We will know we've been successful when that is true for mental health. When you are able to have your employee who breaks down when you're talking to them and you learn that they're suffering from anxiety or panic or depression, and you know exactly where they can go. You call up, they get there, they have an appointment, they get the treatment started right away. It's the right treatment. They get good education about it. The follow-up is good. We'll be successful when we get there.
Great. So let's move on to another question here. But before I do that, I want to invite everyone on the call. If you have a question, you have a couple of options. Feel free to drop your question in the chat and we can cover it that way. Or if you'd like to ask a question, you can just also drop your name in the chat or kind of raise your hand, get our attention. I can't see quite everybody on the screen, so I'll do my best, but be happy to recognize you to ask a question as well. But at this point, would love to invite everyone to participate if you have a question you'd like to bring into the conversation. John, I'd like to turn to you for a question and then get Rick and Dr. Torrey's input as well. You know, you've brought up in both of your responses thus far about how important is how businesses can lead in terms of turning the tide on this and creating more awareness. So, you know, clearly you think businesses should and can lead on this. What are some, you know, based on your experience in traveling around and talking with business leaders, what's the best how in terms of you've seen business can do this? What are business leaders or successful businesses doing in terms of strategies or tips or tricks or, you know, approaches that are making a meaningful progress in businesses leading in this area?
Let me just say, businesses nationwide lose up to $200 billion with a B dollars every year because of turnover, absenteeism, and presenteeism. But businesses can really make a difference. And a lot of it begins with the leadership of a particular company or business, because the culture needs to change inside the everyday business. Most employees are not likely to tell you they're suffering. And studies, the Pew Research Group has found that more than half of employees are afraid to talk about it at work for fear they would lose their job or there'd be some retribution against them for sharing that. When I go around and speak to kids, they respond to me because they know I'm vulnerable. I share my own family story and my own ignorance, and they come forward and share with me. So if I were a CEO of a company, I'd want to be more open and accepting about mental health and maybe even talk about it myself. Some companies are doing that, by the way. They're producing videos of leaders in the company who talk about their own mental health issues. That makes everyone exhale and feel more comfortable. They also need to provide very clear information to employees who are suffering, where they might go, who they might see, what available resources there are. And it shouldn't have to be in hushed tones in a back room. It should be part of policy. It should be part of the culture. And the third thing I would say, it's really important if we're going to change the culture, is we need to train people. We need to train managers and supervisors and ultimately the staff itself about what mental health is and what it isn't, and what a safe workplace looks and feels like as it relates to mental health. We need to do that, and we need to make more resources available. Starbucks, for example, if you Google Starbucks and their CEO, he's doing amazing things in this space, as is the CEO of Cisco Systems. Starbucks is now giving their employees, as of a year ago, 20 free visits every year to see someone for therapy or counseling. That's a huge step forward. That's an acknowledgement that people aren't hollow. And it's the same issue, by the way, Mike, for substance misuse issues. Oftentimes, mental health and substance are co-occurring, but not always. And so we need to be sensitive to that. I know in the legal profession, we have a higher rate of substance misuse than many others. They live under a lot of stress. And it's true in corporate America, too. So the biggest thing I can say is start talking about it, normalize it, have speakers come in and talk about it. And the CEO, he or she, needs to let everybody know that it's important and it's respected and it's part of health, as Dr. Torrey said. It's not some special category, but it affects a lot of people that won't tell you about it. Culture change, training, education are essential.
Rick, what would you add to that in terms of businesses, how they can approach, really leading the charge in terms of bringing more awareness and implementing practices that can really be more supportive for their workforce?
Well, I think having a sense of what this is really all about in the real world, as we look at what COVID has done to all of us, and as we start to rebuild businesses, as we deal with the complexities of the many employees returning to the workplace in many different ways in this new quote unquote normal world, I still believe the same thing I believed before all this happened. In fact, what I believe in has gotten stronger because of it. You see, when individuals are taken care of, when we look at the individuals in a family and their physical and mental health are taken care of, then their family is being taken care of. And from there, the family jobs are taken care of. Why? Because people go to work every day healthy. This in turn leads to the businesses being taken care of, and thus the community with all of its healthy businesses and healthy people prosper. And what's really cool about this is that you can reverse that path of care and get the same results. Everyone wins, but it only happens if everyone does their part. If everyone lifts each other up and everyone supports each other's needs, if everyone can just open the doors of vulnerability for a few moments, we can all let each other in and know that we're all affected. People will feel free to talk when this happens. And through that talking process, I truly believe that healing will happen. The process of rebuilding will happen. Our businesses will be stronger. Our communities will be stronger. Sometimes, like John said, it takes a strong and assured CEO, a board of directors, a company owner, strong people that are willing to be vulnerable. But the payoff is unbelievable. It's limitless. That's what I think.
Thanks, Rick. Will, I'd like to turn to you, and if you have a comment on that question for in terms of businesses and what would you recommend they do, that'd be great. But I also wanted to lump into that for you a great question that came in from the chat from our audience that I think you would be ideal to answer for us. The question was, do you feel that telehealth has been an effective option for those suffering from mental illness, either as a stopgap during the pandemic or as an ongoing option? And just in terms of its effectiveness, it seems like, we're just like today's event. We're doing so many more things virtually out of necessity. And in some cases, we're learning they've been more effective virtually. And so when it comes to telehealth for mental illness and providing those services, do you think, has that been a good option? Has it been effective, or are we still studying and figuring out how the last year has gone?
Sure, I'll address that. Let me just first say about business. I think that business is the lifeblood of our country. It's what drives things economically. You are in the ideal position to be advocating for removing barriers to mental health care. It's crucial that the business community be out there in front fighting for access to high quality care. And both generally and politically, but just personally in your own companies, to make it easy for people to seek care, to make sure that your insurance policies don't create undue obstacles for payment. The mental health is managed more tightly. A lot of insurance companies have carved out mental health, and the companies that are in charge of managing the mental health often put great obstacles in the way of care. So I think you all are in a position to be absolutely clear that you're supporting your employees by making it easy for people to seek care when it's needed. And you're in the perfect position to be doing that. So in terms of telehealth, there's no question that telehealth all the studies have shown that telehealth is extremely effective in providing services. People, even before this, I was caring for people who were in a nursing home in Rutland over my computer here in Lebanon. It kept me from having to spend that time driving to Rutland. It allowed more access to care. So it reduces travel. What telehealth, and you can connect with people quite well. It's not the same as being in a room. If we were all in a room together, it'd feel more intimate. When I'm evaluating someone for the first time, I'd much rather be in the room with them so that we can know each other and see how each other behave. When I know patients well, telehealth and follow-up can be really good. It's more effective in my view in follow-up than in early evaluations. But what it doesn't do is it doesn't create more providers. If we can't get everyone in who's seeking care here today, it doesn't help that I could be touching 1,000 more people over tele, because I still am just one person. And I can't make 10 of myself by doing tele. It removes travel time and it's clearly useful, but it's not the answer by itself.
Great. Let's move on to another question, and a reminder for everyone, we're about 12:40, so we have around 10 or 15 minutes left. So if you have other questions, feel free to drop them in the chat or get our attention. We'll be sure to recognize you. Since this is a chamber podcast or a chamber forum with business folks on here, I think it's been so helpful that our conversation has been honing in on workforce impacts. And I'm wondering if we can just drill down into that a little bit more deeply in terms of, for business leaders and folks who are running companies or in charge of human resources for their different companies, really getting into how does mental health affect the workforce? And I'm not sure which one of you mentioned this, but I hadn't heard it before. It was presenteeism. That might have been, was it Will who said that? That was a new term to me, but it made a lot of sense that essentially a person is able to show up for their job, but just isn't being productive. And I think, John, you highlighted a few numbers in terms of lost productivity and how that impacts businesses' bottom line. So maybe we could just go back to that, since you each touched on it in previous answers. And John, really start with you perhaps about how mental health can really impact the workforce of a business in terms of their results and productivity and just the culture of an organization. And for those reasons, it becomes really the type of business issue that any business owner would be, it makes all the sense in the world for them to put a focus on, much like they would put a focus on marketing or some other core business activity.
It's funny, Mike, because the most valuable asset any business has are their employees. Your employees are more important than your marketing budget, because if they're not functioning well, it doesn't matter what you're marketing, you're not going to be able to deliver it. And the three components of the $200 billion I mentioned to you, one is you train people, which is not inexpensive for a lot of companies, but they don't stick with you. And some of that is many times mental health, either theirs or someone at home, or a substance problem. The second component is absenteeism. The principal cause of absence from work is not what I thought it was, which was a day at the beach. That's not true. Most of absence from work is mental health or substance related, either the employee or someone they love. And then the economists have come up with this presenteeism term, and they estimate that the average employee loses about 2.25 days a month, even though they're physically at work. because they have mental health or substance problems or someone they know does. They also, as according to the surveys, are uncomfortable talking about it. It's an uncomfortable topic. It's always been, it always will be. I see on the screen Kim LaMontagne, who I think is going to be speaking to all of you. She's a rock star in my mind. And she talks about these issues and the culture and the language we use or shouldn't use. We can keep people more focused, more productive in a safe environment. And sadly, in most companies, mental health is out of bounds. And so when people feel comfortable, when your supervisors and managers and CEOs know what mental health is and isn't, we'll do a whole lot better. The culture will change. Hypotherm, for example, in Northern New Hampshire, they should get a gold star on their forehead on mental health and substance. So there are people in the state that are doing it. Bob Quinn, with Kim's help, I might add, Bob Quinn, who's the commissioner of safety, former head of the state police, kind of a tough guy, you would think. He is, but he's a smart guy too. So what did he do? There are 1,600 employees at the Department of Safety. It's many more than our state troopers. And he opened or started a program on wellness and resiliency. They sent out videos for the last few weeks talking about how important it is. He wants to change the culture. That's what it requires. And if you do that, and suddenly it's not out of bounds, and when you say to your employee, how are you feeling? You're not just doing it to pass the time. You're really listening to what they say. That's important too. It will change your bottom line. It will keep people in your company. And it will create a workforce that's very different than the one that exists in many places now.
Thanks, John. And I'm so glad you reminded us of the event we're hosting with Kim in a few weeks. Heather from our team dropped that information into our chat. It's part of our CEO Roundtable series. So would very much encourage folks interested in today's conversation to sign up for that conversation and really hone in on action steps business owners can take in the workplace. So we have just a few minutes left, and Rick and Will would like to come to you to wrap up with some comments on this question that John was just commenting on in terms of your thoughts about really the effects in the workplace, why it's so important, kind of perhaps your experience with some instances where you've seen that this can really have a significant impact on organizations, and both perhaps in the negative and when it is addressed the positive, and how it can lead to really a healthier workplace, which ultimately means a healthier business. So Rick, do you want to start first there?
Can you imagine a business that sponsors an AA meeting in its business? Can you imagine a business that says, folks, if you're having a difficult time, we want you to talk about it. We want you to, and you don't have to worry that you're going to lose your job because you're having a hard time. That we all have hard times. And it's important to us that you're feeling well. It's one thing to have a business that supports a gym. And that takes care of a lot of, great physical issues that might be going on for somebody. It's a great stress reliever. But why not something that has to do with mental health? Why not something that's creative? I think the more that those people in positions of power allow people to talk about what's going on, the more that they normalize that, the more they're going to find that people want to open up, people want to talk. I've never found anybody in all my years of therapy with people where they didn't really want to talk. They wanted someone to listen, but they wanted to talk. And getting those feelings out is so important. And there's so many ways. When an organization takes a step to be on a board of directors of a local mental health center, that's making a statement. When a board of directors says, we're going to take on this particular group in the community, and we're going to make sure that those people are emotionally well, that's really making a statement. And those are the kinds of actions that I think all businesses can do on a regular basis. We have some great businesses that do that now. But there's still a lot of, I look out there in the city of Manchester, and there's a lot of businesses out there I'd love to talk to. But I think that's sort of what I was trying to get at before, that it's making this normal, that it's normal to have feelings, and that shouldn't mean that you can't work here. If anything, it means we want you to work here, and we're going to help you deal with whatever you need to deal with so you can. That's a great workforce. That's a great company.
Thanks, Rick. I actually, that's I think a great point, that from the business community perspective, over the past, several years, decades, an emphasis on employee benefits that are focused on health and wellness, whether it's gym membership or other types of wellness, have become pretty normal. But this is an area in terms of mental health that, we haven't quite reached that same level of parity. So I think that's a great way to frame it for businesses. Will, let's go to you to wrap up on this topic in terms of effect in the workforce, and kind of your thoughts based on what Rick and John have shared so far.
Sure. First of all, I think you in Manchester are very fortunate to have Manchester Mental Health there. It's such a wonderful organization that's been solid year after year, and is a leader in the state and in the country in our field. So you have a lot to be working with. As a psychiatrist, this has been a really wonderful profession to have over time. I get to talk to people about things that really matter, sort of at their core. And it's not surprising, but still, it turns out that people have very complicated lives. No one gets through life unscathed. A lot goes on. And I think that people do their best work when they feel like they're cared about as a human being in their full complexity. If you can demonstrate through providing support for mental health and addiction that your employees matter, that they matter to you, they pay you back with loyalty, and they pay you back with effectiveness, and they pay you back in just, bringing your mission forward, because you've demonstrated respect for them. So I think businesses are at the heart of this whole issue, and I think addressing mental health is good for business.
Great, thank you for that. This has been a really great conversation. I think we've covered a fair amount of ground in a short period of time. A couple of wrap-up notes. This session was recorded, and the Chamber will be posting it on our YouTube channel, and making it available for folks to share and to rewatch. So would very much suggest and challenge everybody who tuned in today to share it with a colleague, share it with someone in your firm who is responsible for having these types of conversations, and please make use of this. We are also going to send around a follow-up email with some resources and reading material and tools, thanks to our partners here today, and other suggestions that could be helpful for businesses. So please stay on the lookout for that. And if you have feedback on things that we can incorporate into that, please let myself or Heather know as well. Would like to thank you, Rick and John and Will, for joining us and sharing your expertise, insight, and time. Really, really appreciate it. We're going to leave the Zoom open to 1 o'clock. So just like if this was at the Chamber office, those times that you get to chit chat and catch up with everyone on the way in and way out of the meeting. Hopefully we'll be back to doing that in person soon. But we'll keep the Zoom open here for a little while. And if you'd like to connect and say hello to one another, please do that. And again, hopefully we'll be doing that in person soon. So thanks everybody for the conversation and for tuning in. And again, thank you, Rick, John, and Will, for your time and sharing your insights today. Thanks, everyone.
Thank you.
Thank you.
Thanks.
Got a few. This is always the fun part. Okay, let me stop this.
Hi, it's Mary Ann.